Hi, everyone. So, this is the part where I'm going to talk about my time working on Northwell Health's Human Trafficking Task Force as an intern. This was the coolest opportunity I could have ever got. And to give some background, since most of you are not from New York, Long Island has major hospitals, Northwell being one of the top major hospitals on Long Island. They are growing entities on entities. It is crazy. Even when I was working there, I didn't realize how many entities were in Northwell now. So, I had the opportunity to work on the Human Trafficking Task Force, which before that, I didn't even know there was such a thing. And I was so excited to learn what they did, what their mission was, and what they do on a day-to-day basis to try and combat human trafficking on Long Island. Now, Long Island's human trafficking rates, as I've said multiple times in our classes, are double the national average of the United States as a whole. So we deal with a lot of trafficking, labor trafficking, sex trafficking, not so much organ trafficking that you see more international and in global affairs and stuff. But yeah, so this task force was created in 2017 by Northwell Health, and by 2020 they had ties to the United Nations and international affairs and just people that were dealing with, global organized crime, anything like that. So it was so cool to see in 3 years they grew to that length, and people do from that task force travel abroad to, talk about these major global problems. So the coolest part, I think, was that this task force was created by Northwell to go into all of the Northwell facilities and educate all of their staff in these hospitals on what human trafficking is. Because the biggest problem, and this is a big, big part of my project, is those hidden realities in the healthcare system and how there are so many individuals that go unidentified because the healthcare staff isn't educated on what human trafficking is. And that's not their fault, obviously, but Northwell implementing this is something that is going to save lives. So what we did is we went into a lot of the healthcare facilities with human trafficking 101, 102, and 103 trainings. And each of these trainings gave all of those floor staff a better idea of what trafficking was. And then it kind of shifted into different, more intense things as it went on. But the major goal was to educate the staff as if an individual came into the healthcare facility, what are the red flags? What are the signs of someone that is a trafficked individual? And I think the most fascinating part about this was after some of the trainings, I got to I would walk around and talk to some of the nurses, some of the social workers, everyone that was kind of involved in these trainings. And a lot of the nurses did get emotional and they said, I am pulling out people right now that I think were trafficked victims, but I didn't have enough knowledge to know that this is what was going on. So I think that was a major piece of it, the hidden realities of the healthcare system and how unidentified these people can go through because there's no education, on a staff basis. And that, again, that's not the staff's fault, but implementing things like these can really, 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 really help. So I got to do a broad range of things. A major part of the community population group there was advocacy, advocating, putting the word out there, making sure people understood what human trafficking was, what are the signs, what it is. And also working in the prisons, going to all, understanding the law enforcement side of things, how they feel about trafficking right now, how are they doing things, are there grants being passed to help? We have a task force, so we have Nassau County and Suffolk County. We have a whole human trafficking task force on the Nassau side, but we don't have it on the Suffolk side. So they were trying to pass a grant for that. So just different things like that, advocating for more and more and more on the legal side, on the advocacy side, on the healthcare side. But all of these things tied definitely into what my aspect of this compendium was when it came to understanding, how systems of power, connect into trafficking. And unfortunately, through the healthcare system, that also plays a major role because we're dealing with individuals that are coming for help, but they don't necessarily know how to get that help because they're so psychologically abused and scared. And it's like, how do you navigate that? So I just wanted to give a brief overview to give you guys a better idea. I also linked an article on more of the actual task force and wonderful Walanda, she's the face of it. She was my sponsor guidance, the woman that I worked very closely with the whole time. So take a look at that. And yeah, and I also linked slides as to if we were to go into a healthcare facility. I didn't want to link the actual Northwell ones. I didn't know if that was like a copyright problem or not, just because I don't work for them anymore. But I made some of my own as to what we were doing when we were going in, and I linked a 101, so you guys can take a look at that as well.